My name is Chloe Sermon, and I am the physician liaison for neurology and neurosurgery here at Mayo Clinic, Florida. Thank you so much for tuning in. I have the pleasure of sitting with Dr. Ryan Whedy, who is one of our movement disorder neurologists here at Mayo Clinic, Florida, as well as Dr. Sanjeet Graywall, who is one of our neurosurgeons here at Mayo Clinic, Florida. Thank you so much for being with me today, Dr. Graywall and Dr. Whedy.
My pleasure.
Let's start with having Dr. Whedy, if you want to introduce yourself, tell us a little bit about your background, why you work at Mayo Clinic, what you're passionate about, and then we'll have Dr. Graywall do the same.
Okay. Well, I grew up in the Midwest and ended up doing my neurology training at Mayo in Minnesota, and really embraced the idea of teams working together to do probably more for a patient than any one physician could do on their own. I have seen patients at all three of our main campuses and been headquartered here in Jacksonville, Florida for over 20 years. I have a subspecialty interest in movement disorder patients or taking care of movement disorder troubles, and we'll talk about that in a few minutes, but I really enjoy seeing these patients because I think very often we can help them.
Wonderful. And Dr. Graywall, tell us a little bit about yourself.
So Chloe, you really had to have me follow Dr. Whedy. So my name is Sanjeet Graywall. I did my training here at Mayo in Florida, and I spent some time up at Mayo in Minnesota as well. I think I echo a lot of what Dr. Whedy said, where the team-based approach that's used here, I think there's just nothing parallel to that in terms of patient care, which is why I wanted to stay on staff and work with other excellent physicians like Dr. Whedy. I have a specialization in movement disorders, and I think we kind of all get drawn to a certain type of patient when we're training. And for me, I would come back over and over to these patients with movement disorders that we would see after deep brain stimulation or other surgical treatments, and the impact you can have on their life was just very, very rewarding, and couldn't see myself doing anything else.
Wonderful. Thank you so much for letting our audience know a little bit more about each of you. That's very special, so thank you. Today, we are going to be talking about movement disorders. So obviously, Dr. Whedy is representing the medical side of movement disorders, and Dr. Graywall is representing the surgical side of movement disorders as well. So Dr. Whedy, can you tell us a little bit about what movement disorders are? What are the different disorders that are rolled up under that category?
Sure. Chloe, I think if you had to summarize movement disorders, you could say, you know, there are some people, some patients who are having too much movement, too little movement, or just very odd movements. And any of those circumstances can really interfere with a person's quality of life. As a movement disorder specialist, I try to connect the dots between the movement phenomenon and what the likely diagnosis is. To do that helps the patient in terms of what kinds of treatments may be effective. So the different kinds of movements would include shaking or tremor. That's probably the most common type of problem. But there are going to be people who also have involuntary contractions of muscles that don't just cause a to and fro tremulous movement, but that might cause stiffness or dramatic slowness. Then there are patients who also have combinations of these things. So a common movement disorder would be Parkinson's disease. And people with Parkinson's may have a paucity of movement. They may not be moving enough in some parts of their body. And then there are maybe other parts that are actually shaking and tremulous, having too much movement. So they can have combinations of movements. Some patients may have quite a bit of disability just on the basis of tremor. So if a person's hands are shaking, well, you can imagine how that would impact on their life. They may have troubles eating, drinking, writing. Sometimes the shaking tends to be more pronounced in certain circumstances or certain positions. And unfortunately, many people with tremors realize that often the worst position is when their hands are close to their face. And this is really unfortunate because that makes doing a lot of routine activities problematic. So sometimes the movement disorder is fairly obvious and we can make a simple diagnosis, or even the patient is aware of what the diagnosis is. Sometimes it isn't very clear. And that's usually where I can provide some input on what is the real diagnosis. So some of the common diagnoses that I've seen over the years would be Parkinson's disease, essential tremor, that is sometimes even inherited, and different forms of dystonia. Dystonia is a movement disorder where muscles are contracting and usually producing some abnormal posturing or positioning. And that can affect any part of the body as well. So those would be the most common types of troubles.
Thank you so much for explaining those. And then I think that's a nice segue into talking about some of the medical treatments for movement disorders. And then Dr. Graywall, after Dr. Whedy provides an overview of some of the medical treatments for these diagnoses, we'll have you talk a little bit about some of the surgical treatments that might be available for some of these patients.
Absolutely.
So depending upon the disorder, we typically will have a number of treatment options that are available. They might include medications. They might include more physical therapy. They might include injections, like botulinum toxin injections. And then there's also surgery. Now, because the surgery tends to be brain surgery, we usually try to exhaust the other forms of treatment first. Sometimes this is a fairly time-consuming process, but when at a place like Mayo Clinic, we have seen pretty much the gamut of all of these disorders, and we're typically able to determine what might be most appropriate for a given patient. But some of this can be fairly complicated for patients to wade through themselves because there's so much advertising and there's so much information available on the internet, it gets kind of confusing. But in general, as a neurologist, we can provide treatment with these other modes of therapy, medications, injections, etc. And the bottom line thereafter is, are we doing enough? Is this person able to accomplish what they want to do? Are they happy with how they're functioning? If that's not the case, there may be surgical options that can be effective. And that's where, I would call Dr. Graywall, and he's never said no to seeing a patient. So we work together very closely, and I would give him a call about potential surgical options for a patient. So maybe you could talk about some of those and what's involved.
Absolutely. I think one of the key things we talked about in terms of making sure patients have a successful result is diagnosis. If you don't have the right diagnosis, and sometimes these diagnoses aren't as clear cut as they seem, but if you don't have the right diagnosis, no matter what we do, we're not going to be optimally treating our patients. I think that's where this combination and working at a place like Mayo Clinic is so beneficial, where Dr. Whedy is just down the hallway. I can come and talk to him, have a discussion about any patient we think is complex. And we have a team of physicians that work together for our patients. Once Dr. Whedy or one of my other partners believes that a patient is ready for surgery, that means they've tried medical therapy and they are either having side effects or the disease has progressed to the point that the medications are no longer optimizing their quality of life and their function, then we can consider surgical options. There's a bunch of different surgical options, but they really come into two categories when we talk about them. One is lesioning, and there's different ways to create a lesion, which is to make a small little hole that's very precise. And we've understood the brain circuits that are involved in these movement disorders. And we understand that if we put a lesion in a certain spot, we can either stop the excessive movement or we can give a go signal to produce movement in people who are having slowness or rigidity. The different ways to do them, you can do them with either heat or radiofrequency. You can do them with an ultrasound, or you can do them with radiation. The other option is what we call neuromodulation or deep brain stimulation. What's exciting about deep brain stimulation is that it's something that we can adjust over time as the disease progresses. And what that involves is a surgery where we bring you to the operating room. We can do this awake or asleep now, depending on your symptoms. When we do it awake, we do it together where Dr. Whedy is in the operating room with me. And we put the lead in what we think is the perfect location to treat the symptoms. But then we have Dr. Whedy there to confirm that we're getting the results we want before you go to sleep. And we found that to be extremely helpful. And I think the relationship of working together over many years makes that a very efficient and safe process for our patients.
So Dr. Graywall, you mentioned surgery and actually putting a hole in patients' brains, if that is what their diagnoses might warrant. So can you explain that? Because to me, that sounds a little bit scary, and I'm sure some patients are listening thinking, what in the world?
Absolutely, and I understand it being scary. I mean, anytime someone hears, you're gonna put a hole in my brain, that shocks patients, as it should. But you know, we've done several thousand of these procedures over the years, and they're very safe. These are very precise holes. We're talking about a few millimeters in diameter. So they're very small and precise. And we basically name them based upon where we're doing this. So either a thalamotomy or a pallidotomy. Again, you know, one of the differences between any of these lesioning procedures and the more recent neuromodulation procedures is the lesioning procedures, what you get is what you get. You can't really adjust it over time. With stimulation, we can actually adjust the settings over time. So if the disease gets worse or you're starting to have some side effects from the stimulation, we can always adjust that, which is why it's what we prefer to do.
So Dr. Graywall, what are some of the risks that are associated with this type of surgery?
Absolutely, Chloe. You know, with any surgery, there are risks. And one of the biggest risks we worry about is bleeding, which can occur at the time where we put the electrode into the brain. We've altered our technique compared to a lot of other institutions where we don't use these microelectrodes prior to putting in the stimulating wire. So when you look at most of the other series out there, they report a risk of something terrible like a bleed or a stroke happening, approximately 1.5 to 2%, okay? In our series, in over 2,000 cases, the risk of something terrible happening is about 0.15%.
And how do patients normally decide if they want to proceed with a surgical intervention?
Yeah, I think, you know, that's a very personalized decision. And I think they have to come have a discussion about the risks, understand what they are, and then they have to realize how severe are their symptoms depending on making an equation between their symptoms and the risks. For some people, their symptoms are really severe and they can't function. They can't feed themselves, they can't brush their teeth, they can't move. And for them, they say, you know what, those risks are totally worth it. some patients, their symptoms are not as severe, but they're still affecting their quality of life. They feel that they can't play a musical instrument they used to like to play, or they can't play golf because they can't putt quite as well. And in those cases, some patients say, you know, a risk of 0.15, yeah, it's affecting me enough that it's totally worth taking that risk. But there's other patients that would say, you know, that's not worth it for me, and that both are reasonable to do.
Wonderful. Well, thank you so much to Dr. Ryan Whedy and Dr. Sanjeet Graywall for providing such a wonderful overview, not only of movement disorder diagnoses, but also of the care that patients can expect to receive at Mayo Clinic, Florida. We thank you so much for your time, for watching, and we hope that you have learned something throughout this video. Thanks again.